Traffic Injury Guidelines. There are many publications, articles, and guidelines for treatment and care of traffic injuries. These publications are guidelines, not inflexible proscriptions, and they should not be used as sole evidence for an absolute standard of care. Guidelines can assist clinicians in making decisions for specific conditions and help payers of reimbursement determinations, but they cannot consider the uniqueness of each patient's clinical circumstances. In cases where the care or testing is an exception to guidelines, the provider should document 1. Extenuating circumstances of the case that warrant performance of a treatment, including the rationale for procedures. 2. Patient comorbidities. 3. Objective signs of functional improvement from treatment conducted thus far. 4. Measurable goals and progress points expected from additional treatment. And 5. Additional evidence that supports the healthcare provider's case.